is going to be very, very informative to all of you. Okay.
Okay.
So, in this video, we are basically going to work on OET speaking subtest. And as you might have seen the poster, we are going to work on medical procedures. Okay, how to explain medical procedures in OET speaking. This is one part of the whole communication, and there may or may not be procedures in the speaking task. Okay, but how to explain procedure that we are going to work on, and it is part of one of the communication criteria, okay, clinical communication criteria, which is named as providing structure. Okay, so how to provide structure to your interview, that is what the main goal for today's meeting is. All right, so let us start now. Still people are joining, and I'm happy for that. Sorry. So, how to provide structure to the interview? So, it is basically based on 3 points, that is, sequencing the interview purposefully and logically. So, I hope many of you know about OET speaking subtest, and some of you might be unfamiliar with it. Okay, so let me just give a brief story how it will work on. So on the test day, you will be given a card, okay, a cue card, in which the scenario will be explained. Okay, you will be given the setting, the background information regarding the patient, and some tasks. You will be given few minutes to prepare for the task, and then you will need to speak for about 5 minutes. Okay, so providing structure is basically based on 3 things. The first is sequencing the interview purposefully and logically. Now, what does it mean? So, when you look at the task, you need to decide during your preparation time that how are you going to deal with this certain tasks. Okay, how are you going to begin the communication, or how are you going to proceed? What all points requires in-depth explanation, and what are the points that you just need to, give a brief story and just move on. Okay, so that is called a purposefully structured interview. And it should be logical, of course. Okay, it shouldn't be the thing that I want to use firstly, secondly, thirdly. So, anyhow, I'm going to set it in my role play. No, it is not going to work in that way. Okay, if you have certain steps to explain, then only that will work. Okay, so just don't use any mugged up things, rather work logically. All right. So apart from that, the next point is signposting changes in the topic. So signposting is what? Here you can see, you must have seen this kind of arrows in your hospitals, okay, or in your colleges, right? Here on this side, we have operation theater. On that side, we have medical ward, right? So that is signposting. And the same thing you need to do even during your speaking tasks, okay? You need to show to the examiner that what point are you going to be discussing about. Okay, so you need to show the sign. And the last thing is about organizing techniques. You need to organize the information in a logical way, okay, based on the given information. So today we are going to discuss on the explanation on the medical procedures. And I'm pretty sure in this group we have pharmacists, we have doctors, and nurses. So welcome all of you. Before I begin, I just would like to tell you all that I have kept you all on mute. Okay, so whenever you want to participate in the meeting, you can unmute yourself and you can speak. And I'm really expecting two-way of communication. Okay, I alone don't want to speak, that I do for the whole day, Monday to Friday, right? So I want all of you to get involved in speaking. Okay, and don't worry if it goes wrong, that's totally fine. Okay, nobody is judging you here. That is only to help each other understand that how it actually works. All right, so please be ready. And keeping your all's profession in mind, I have created one task. I hope it will work for all of you. Okay, so let us begin and let's see the scenario first. A newly diagnosed asthmatic patient requires your input for the explanation of asthma and inhaler use. Okay, so of course your knowledge is not assessed in this test. So what is asthma is already given in the bracket, and also how to use inhaler, the steps are already provided. So similar kind of information will be given even in your task during the exam. Okay, so not to worry, don't apply your knowledge. If you have no idea, if there is no bracket information, if you're explaining something else, it's okay. This is just your English language test, not the medical test. Okay, so please don't worry about it. All right, I just want to feel present of everybody. So I want all of you to unmute once. Please, please unmute yourself. Yeah, thank you so much. Yeah, please keep it unmute. Please keep it unmute because I want your participation. If you have background noise, it's okay. Otherwise, I request you all to please keep it on unmute. Okay, fine. So, how many of you have already taken the test or who all are already preparing for the test? Anybody?
Yes, ma'am, I'm already attending the exam.
Yes,
Okay, that sounds good.
I'm preparing.
Okay. Anybody who is totally new, who have no idea about the test? Anyone? Okay, fine. So I hope all of us have some knowledge, some background information about the OET speaking subtest. So I will jump into the task now. Okay. So, can anyone say that now? Suppose we are not beginning the whole interview. My today's goal is only to explain the steps of the procedure, basically, okay, or to work on providing structure in the clinical communication criteria. So, suppose this task is given to you in the exam that it is a newly diagnosed asthmatic patient who has no idea about what is asthma or how to use the inhaler. Okay, so there are basically 2 points that you need to explain. So, can anyone tell me that how will you begin this point particularly? Anything? Okay, let me act like a patient and anyone volunteer can answer. Okay. Suppose I am patient and I am saying that, hey, the doctor has diagnosed me with asthma and he explained me what asthma is, but I was so nervous that I couldn't pay attention to what he said. So, could you please tell me what is asthma?
Firstly, explain the asthma, what is the
Hmm.
disease condition, and
Hmm.
then after, if he or she has a doubt about the procedure, then I explain the procedure step by step.
Okay, that's true. But can anyone tell that suppose how will you respond to my question? Can you explain what is asthma? Suppose I said I have no idea about it. Could you please tell me what is asthma?
Yes,
Actually,
don't
asthma is
worry about.
Yes. Yes, Sheetal, go ahead, please.
Yes, don't be anxious or
Hmm.
worry about it. I will explain you what is asthma is.
Okay.
Asthma is a condition in which inflammation and narrowing of an airway and extra mucus and breathlessness is occur.
Okay.
Are you
Yes.
following me?
Okay, right. Yes. Now I will make a little change, Sheetal. You have done fantastic job, but I will make little changes, okay, over here. So your empathy was totally good. Okay, don't worry. I'll surely explain you about what asthma is. It is a condition in which this is how you have started, okay, but then your progression was little altered. So you may say that yes, asthma is a condition in which there is an inflammation and narrowing of an airway. Okay, and because of which there will be accumulation of extra mucus that obstructs the airflow, causing breathlessness. Are you clear about asthma? Okay, so basically, it is kind of a cause and effect kind of thing. Okay, this occurs, this is the cause, like inflammation and narrowing of an artery. As a result, there will be extra mucus, which leads to breathlessness. Yes?
Yes.
Yes,
Okay.
ma'am.
And the second thing is that instead of just asking, is that clear? Make it task specific. Okay. Are you clear about asthma now? Do you have any other
Yes.
question about asthma? Okay. Fine. Coming to
Yes.
my interesting point is that explain the use of inhaler. Well, the doctor has given me this inhaler, but how should I use it? I have no clue at all. Yes, any doctor now or pharmacist. Yes, Parth, you have raised hand. Are you willing?
Yeah.
Yeah,
Yes,
please go
ma'am.
on.
Right.
Yes, please go.
So for the use of inhaler, first of all, you need to sit on a upright position. Then you can find that open the mouth, please.
Mm-hmm.
Before you put that in your mouth, you need to shake it well,
Mm-hmm.
right? And just put that mouthpiece in your mouth and close it with the lips. Then sorry, like here we need to use that in the air before use the fuse spray. Right.
Okay.
So before you use, you need to spray in the air to activate that pump. Then you need to put that mouthpiece in your mouth and seal around with your lips.
Mm-hmm.
You can press and inhale at the same time. You make sure you need to take a 1 minute break before each puff, and you can take only two puff at a time, and you need to make sure like the time interval between this dose is 4 hours. Are you
Oh,
clear with
okay.
me?
Yes, I am. Thank you so much. Yes, Parth, fantastic job. Okay, you have done the right thing. Of course, you got stuck with priming the pump, right? But
Yeah.
it's okay. And basically, my goal was to work on the procedure. Okay. And you have given me some extra information like I should use two puffs at a time, not more than that. I should have gap of 4 hours. That's okay. But in your real task, okay, if you have all this information in the next bullet points, make sure that you wait. Okay, and let the patient ask the question, or you can prompt the patient to speak. Okay.
Right.
Yes, fine. So, yes, you can say that absolutely. Let's talk about the use of inhaler. Okay. Anyone else would like to try? Yes, Parth has done his job. Anybody else would like to try? You can raise your hand. Come on. Yeah, it should be two-way communication, right? It shouldn't be one way. Fine. Oh, fine. So let's talk about this. So first of all, in first bullet point, like if you have seen that we have structured the interview purposefully, like while I'm preparing, I will decide that this is the procedure. So I will explain this procedure in steps, right? Firstly, secondly, then, finally, and it's done. Okay, so that is purposeful and even logical because it is a steps of procedure. So I will definitely explain in steps, right? Second thing is signposting. Don't worry, I'll explain you what asthma is. Don't worry, let me explain you. Okay, I'll explain you about the steps of something. So that is signposting. You are helping the examiner to understand that you will now explain the procedure, right? So that is signposting. And using the organizing techniques. So that is what firstly, secondly, then. So like if it is not a procedure, you may not always use firstly, secondly, thirdly. Okay, you may even say that this is what you can do. Okay, another thing you can do is this. And finally, you may also try with this. Okay, so if the it is not a step or it is not the information that correlates with each other, in that you can use other organization techniques. Okay, but here as it is procedure, you may say first of all, you need to sit in an upright position. But before that, what you have to do? Signposting, right? Sure. I'll explain you how to use this meter dose inhaler. First of all, you need to sit in an upright position. Then you should open the mouthpiece and shake well. After that, you need to prime the inhaler. That means you need to air spray some puffs so that it will be activated. So that it will be activated. So again, cause and effect. Okay, you need to prime the inhaler, which will activate it. You need to air spray some puffs so that it will be activated. Okay, then you should keep the mouthpiece in your mouth and make sure that you seal it completely with your lips. Finally, you need to press and deeply inhale at the same time. This will allow the medicine to reach deeply up to your lungs. Are you clear about the use of inhaler? Do you have any other concerns? Okay. Are you all clear
Yeah.
about organization technique?
Yes,
Yes.
ma'am.
Yes, ma'am.
Okay. So would you like to try another one?
Yeah, you
Let
can.
me see. Okay. Let's do the easy one. Okay, this one. Here you go. You are talking to a 65-year-old patient who has been prescribed injection enoxaparin 40 mg subcutaneously. She is being discharged today and has planned self-administration of injection. Explain the procedure. So which procedure you will be explaining? Subcutaneous enoxaparin, right? I hope you all of you have seen. Yeah?
Yes, ma'am.
Okay. So how can you explain the steps? Anyone who is new in the meeting, can you try please? Healy, Bhakti, Rajvi, Dr. Krunal. Yeah, anybody who wants to try? Okay, then go ahead. Whosoever is volunteer, please go ahead. Urvashi, are you there in the meeting?
Yes, ma'am.
Okay, can you try please?
Yes, ma'am.
Okay. So this is a patient who is 65-year-old and he or she has been prescribed enoxaparin subcutaneous 40 mg to be self-administered. So you need to explain the procedure. So how will you do that?
Yes. Don't worry, I will explain you the procedure about how to take self-injection.
Yeah.
In that procedure, first of all, clean the site with alcohol swab and then gently pinch the skin with your thumb and finger for take injection.
Mm-hmm.
Uh, and then introduce your needle uh,
Yeah.
Introduce
can
the whole length of the needle
Hmm.
vertically into your skin fold, uh, and then push the plunger uh, to inject in your body. But keep in mind it should be slowly, and then remove the needle and uh, apply pressure for 30 seconds. But do not rub.
Yeah.
Are you understand about the procedure?
Yes, I do. Thank you. Okay, how was that? Urvashi,
Good,
how was
ma'am.
that? Good. Yes? Is it good in explanation? Yeah. Let us make it a little more with clarity. Okay. So I'll explain you about the subcutaneous administration of enoxaparin. First of all, you need to select the site and clean it with the alcohol swab. Secondly, you need to gently pinch the skin with a thumb or a forefinger and make sure that you keep a hold till you complete the procedure of injection administration. Thirdly, you should introduce the whole length of the needle vertically into the full thickness of the skin fold so that it will enter up to the subcutaneous fat. You should then push down the plunger to inject slowly. It's done. You just have to remove the needle. It's very tiny. And then you should apply some pressure for at least 30 seconds. Lastly, make sure that you do not rub the area. Are you clear about the steps of subcut? All right. Clear? How was that? Good?
Clear,
Fantastic.
clear.
Good, ma'am.
Interesting. Yeah.
That's amazing.
Yes. So, see, when you explain, it should enter in your patient's mind. Okay. Whenever you're speaking, make sure that your patient is visualizing. Okay. Of course, in the real scenario, we demonstrate or we may show some pictures and all. But here, we are explaining just by words. So, we needed to encourage the patient by explanation, by our tone, by our voice, and also by appreciation. Okay, like it's very tiny. Okay, you are done. So this is what will help the patient to create positivity. Okay, and when you are explaining, first of all, then, so patient will keep on visualizing that. Okay, first I need to do this, then this, then this. Okay, finally I need to do that. So it will remain in your patient's mind, okay, for a longer duration. I hope you understand. Yes.
Yes,
Yes,
ma'am.
ma'am.
All right. How many of you know uh, the pigostat? Have you seen this?
No.
No,
No,
No.
ma'am.
ma'am.
Anybody who has this machine in their hospital? I don't know whether it is there in India or not. It's in Western countries. Okay, but in
Mm.
India, I haven't seen it yet. Let me know if any one of you have seen it here. Okay, and as it is in use for last 55 years, it's very common for them, right? And so they may ask you, so here I have created a new story. Let's see. The parent of a 3-year-old daughter. So now we are talking with the third person singular. Okay, your patient is daughter, but you are talking with the parent. Okay, so the parent of a 3-year-old daughter, and always start imagination. Okay, like I'm female interlocutor, so you can start visualizing that a mother and 3-year-old daughter, okay, is concerned that his or her child will not stay still during the chest x-ray. So here still meaning quiet, okay, will not be immobile. That is what the concern of the parent. Okay, yeah, and you need to explain the picostat procedure. So let me first of all give you some idea how it works. Like here, the child need to sit, and this seat is like a bicycle. Okay, so they will enjoy sitting there. So they will sit here for an X-ray. Then these are two shields. Okay, that will close from both the ends, from here and from here. It will be closed. Okay, and you can see that the tiny hands will be outside, right? It looks funny, but it's scary for the child and the parent both. Okay, and then the radiographer will take an X-ray. Okay, and the lower part of the body will be below this table, and that will be protected with the shield so that unnecessary rays can be prevented. Okay, so I hope you have learned something new, and now let's see the procedure. So, explain Pigostat, a method to help children remain in a still upright position for chest X-ray exams. So here you need to reassure the mother that don't worry, we use Pigostat machine for a very young children, and we are going to use this for your daughter as well. Now let me explain you what exactly happens and what is Pigostat. So first of all, Pigostat is a method used to help children remain mobile during the procedure of chest X-ray. Okay, of course, the device looks funny, but it's quite helpful to take x-rays. Now, let me explain you the procedure. First of all, your daughter will sit on a small adjustable bicycle-like seat. So there won't be any problem when it comes to giving a seat to the child. Secondly, two plastic shields from both the sides will support your daughter's upper body. It will fit around her sides to hold her arms above the head. Thirdly, we will apply lead apron on the lower half of the body so that unnecessary radiation can be prevented. Then, finally, the radiologist will take X-ray. As the procedure takes about 5 to 10 minutes, it is important to keep your daughter engaged. So meanwhile, we will provide her some soft toys or any toy which she loves the most. You can also sing a song, okay, or you can just verbalize some alphabets according to your daughter's interest. So that will keep her engaged and will not give her any scary feeling. I hope you understand. Yes?
Yes, ma'am.
Can we
Yes.
do that? Yes. Will it be clear for the mother? Yes. Will it be encouraging for the mother? Yes,
Yeah.
Yes.
Yes.
of course, right? When we are explaining in advance that this is going to happen, okay, and we will protect her daughter in these ways, then yes, definitely she will be reassured. Yes?
Yeah.
Hope this
Yes, ma'am.
meeting, I would like to end this meeting, and now this is time for you to ask me questions. Okay, we have last 5 minutes. So whatever questions you have regarding this explanation, please do let me
Ma'am, uh, I have a question. Like in OET speaking, the tasks are like that only, or something different?
know. No, it is not the entire bullet points. It is just a part of many bullet points, but it will be similar. Okay, like you will, if you have any task like explain the procedure, you do not need to have prior knowledge of the procedure. The steps will always be mentioned in the bracket, but as you might have seen that it is not in full sentences, right? It will be the chunk of information. Okay, clean the site with an alcohol swab. So this was a full sentence, of course, but gently pinch the skin with a thumb and a fingers and hold for the duration of the injection. So you may have the pieces of information. Okay, you will definitely need to apply some grammar in that.
Hmm.
Yes. Was there any
Yeah,
other
but my
concern or from this perspective?
no, no, it's all right.
Okay. Yes, if you have any other thing in your mind, you please let me.
No, that's completely worth
Okay,
it.
fine. Okay, anyone else?
No, ma'am.
No, ma'am.
Okay.
When will you arrange the next that group discussion?
Group discussion will be, I'm planning to hold it on every Saturday so that we can work on, like today we have had explanation of procedures or providing structure. So I'm planning to take um, one part of assessment criteria every Saturday.
Yeah, that sounds good.
Yeah, because we are working from Monday to Friday, so I'm hoping to add one more session on every Saturday for the explanation. It will be short explanation like today's, but I want your inputs as well. I want everybody to get activated, right?
Yes.
Then only it
Yes.
Yeah.
will means I will understand that okay, people are interested, so I will all these tasks are prepared by me. Okay, so I'm not afraid of copyright. Okay, I'm not afraid of anything now. But I have prepared with a lot of efforts. Okay, each and every task took about 1 hour to prepare. Okay, to research, to get the topic, to put it into OET format and all. And so I'm hoping that I should also get responses from your end. Yeah,
We
I
are
know it's
appreciate
first
for
meeting.
that, ma'am.
Thank you so much. And I know this is first meeting and we are meeting many new people. So this meeting, I was expecting that it will be little bit mm, one-sided, but I'm expecting more input in the next Saturday, right? And we have already created WhatsApp group. So you can write the topic of your interest, okay, whichever topic you want me to discuss. Otherwise, I'll be always there from whatever I feel is appropriate for you. Okay, but if you want me to have something different, please do let me know.
Yeah.
Okay,
Well, is it a different session or only on the speaking one?
let's see, we can plan something else as well. It will depend on your demands, right? Yeah,
Yeah.
sure. Okay,
Okay,
but
ma'am.
some essence of change in school. Okay, like I'm spending half an hour, but within this half an hour, I should see that if you see any procedure in your task, you should be confident. Yes, I'll deal with it. Okay, so I will come up with all different types of information that they ask in the exam. Yeah.
Yeah.
Okay.
Yes, we have last 2 minutes. Anyone, please, if you have any query. I thought I will be able to cover only one task. I'll be hardly able to move on to another. This was actually for the homework.
You did a homework for us.
Yeah, I did it. But you will have to do it, okay? Because it's not my test. I'm done. Yeah. No worries. Thank you so much, everybody, for your presence. And I hope you have learned something new today. And if not new, at least something in a different way that you can do, especially the thing of cause and effect. Let me summarize that you need to do three things. Okay, think in advance that how we are going to proceed in this task. Secondly, always show signposting to the new topics every time. Okay, okay, don't worry. I'll explain you about what asthma is. Now let's discuss about the inhalation process. Okay, that will help the patient and the examiner to understand that you are switching from one topic to another. Otherwise, it will be the jumble of information and patient won't be able to recall them all. Okay, that is why
Yeah.
signposting is important. And lastly, you have to organize your information because if you give that, you have to make dietary changes, you have to do stress management, you have to change your dietary, whatever pad, it will not retain in patient's mind. So always say
Mm.
firstly, secondly, thirdly. So it will be quite helpful for your patient. Okay, that doctor said that I need to make three changes in my life. Okay, so that remains for a longer duration. Okay.
Sure,
Yeah.
ma'am.
Yeah, ma'am.
Yeah, that's it for today, everyone. Thank you once again. And please be available next Saturday as well. We will be there for about half an hour and it will change your score for sure. Okay.
Thank you.
Thank you, ma'am.
Thank you so much.
Okay. Bye. Bye.
Because I left hospitals long back. So it is called pigostat machine, and it is used to take an X-ray of infant. Okay, like from 0 to 3.5 years. And interestingly, this machine is in use for last 55 years in Western countries. Okay, but in India.